Welcome back to Fox 8 News in the Morning. Talking to your teenagers about depression can be a bit of a difficult conversation, but the good news is there is a number of resources out there that can help parents find a starting point. A local organization called Life Act is working to get some of those conversations going, and Dr. John Hertzer joins us now with more information about the organization. First of all, Doctor, thank you very much for joining us this morning. Let's talk about Life Act and its mission.
Well, thank you, Wayne. Life Act is a tremendous organization delivering their programs in usual times in the school settings about the importance of recognizing symptoms and signs of depression in students and peers, and with a greater mission to help to prevent suicide. And now, with schools not in session, Life Act has responded virtually with programs such as Life Chats, which is a collaboration between Life Act and Highland Springs Changes, led by therapists experienced in treating adolescent mental health issues and providing those life chats online through their website, lifeact.org, as well as on YouTube.
How effective is that, having that type of conversation online?
I think it's been very effective, and students have been provided the opportunity to ask anonymous questions as well.
If you are a parent and you think your child is going through something, what's the best way to approach he or she?
Well, to do so in a very honest and caring manner, to be very calm and clear. Kids take a read from their parents on how they are acting and responding to any situation, particularly now with this pandemic.
Mm-hmm. Why is now such a critical time, Doctor, to talk about this particular situation we're going through right now? Why is this so critical for those who may be suffering from depression?
Well, the isolation over the last couple months can exacerbate depression, and parents need to recognize that and know that opportunities exist to get appropriate mental health care virtually through telehealth, such as what we're doing at University Hospitals, Cleveland Medical Center. Our field really lends itself to the telehealth opportunity, and we can conduct initial assessments as well as follow-up visits virtually.
You mentioned recognize. Talk about what you should look for, the signs that you should kind of be on the lookout for when it comes to your kids.
Yeah, symptoms of depression can be sleep or appetite changes, loss of interest in activities, and let me point out, with Responsible Restart Ohio occurring, kids are going to have more opportunities to go out and do some of the activities in a responsible way that they were doing before. And if they don't go out there and do activities that they previously enjoyed, that may be an indication that there's depression.
But the key... I'm sorry.
Go ahead.
No, I would say the key is that the help is available right now virtually, and that's the good news to report this morning.
Absolutely, Wayne. In particular, we're doing our visits via Zoom. There's other platforms available that other practices may be utilizing, but the important message is that psychiatry, child and adolescent psychiatry, mental health continues to be treated and assessed through virtual platforms.
All right, Dr. John Hertzer, president of Life Act, thank you very much for your information this morning. And by the way, we have a link to all of the free content on our website, fox8.com.